I heard he went out with someone else.
What the hell, man?
Is this the Todd?
With therapy, I didn't want to go deep. The Todd really likes to go deep. With consent.
Yes. High five. Hey everybody, welcome back to the channel. The day has finally arrived. Scrubs Revival, Reboot, whatever you want to call it, Season 10, Episode 1. Before we jump into this, let me introduce myself to anybody who may be new here. I am Dr. Todd, internal medicine doctor, and this is Allycia,
Yeah, what's up?
internal medicine wife.
I am not internal medicine.
Carla, you're Carla to my Turk.
But I'm not a nurse.
Was that your caption?
Yeah, I did. I did
could
say
be.
that.
Sometimes you are when we pretend. But kidding. We are so excited to jump in, see what happens when the gang returns to Sacred Heart Hospital. We felt like we never left. One of the most, say, hotly debated thing in our house has been what to do as this aired. Like, our intention was always to jump in. Like, let me rephrase that. Our intention was always to kind of go back and forth. We had to have that serious discussion. Like, do we jump into this right away or do we wait and finish all of the original Scrubs? But when you kind of look at the math, it's like we're going to be releasing those for at least over a year, probably closer to 2 years. And we are going to do it, by the way. So I want to make that very clear to all of you because I know some of you expressed that. Like, please don't abandon this. I want to finish all of Scrubs. At the same time, too, I want to jump into this. And I think it'll be fun to see, as there are potentially like spoilers that we become aware of, we get to then go back and kind of see where that
Originated?
Yeah, like where it originated. Yeah. And so I think that can be another fun thing, too. Those of you that have joined us for the entire journey of Scrubs, we appreciate you being here for that. And we hope you enjoy this as well. For those of you who are new, consider hitting that subscribe button, like, comment, all the things, and play.
Gunshot wound to the left side. Seems to have missed the heart but shredded the lung. BP dropping. He's hypoxic to 70.
Was the pit?
I don't know. Did I say JD? I meant Turk. I didn't think Turk looked any different. This looks like the
Career in
pit.
medicine
I know.
can take you down many different paths.
Runner. Clapping.
Man.
Stop
I've
it.
had that happen a few times.
Oh, have you?
Glad you're feeling better.
So we starting off with a daydream.
Yep.
Do I need stitches?
Sure, being a concierge doctor isn't nonstop excitement.
Concierge doctor.
That's cool.
In your food journal, Lisa, I just didn't expect to see the word smash burger on every page. You gotta get that thing down, Reggie.
And making house calls for the upper crust sure pays well.
I'm more concerned with how it's leaning.
Little Peyronie's disease, maybe. Real quick, we're going to talk about this a little bit. For those, if anybody is new here, I like to take some notes during the episode and then talk about it a little bit at the end.
Sometimes a little bit in between.
Yeah, provide a little commentary in between. But concierge, the concept of concierge, I love that they're bringing in like the new wave, a new era of medicine. And some of you may be aware of concierge medicine, sometimes referred to as VIP medicine. Basically, it's what you get if you can pay for it. And they're always trying to recruit docs into this. I receive probably emails 5 times a week about join this concierge practice, which I have zero interest in. But we'll talk about concierge medicine a little bit at the end.
Yeah.
For those of you who don't know what it is. But I think we're going to get to see a little bit of Sacred Heart here. Facelift.
One of my patients collapsed at her grandson's soccer tournament nearby and got admitted. So here I am.
So his patient got admitted into Sacred Heart. So that
Okay, listen up, people. Listen up. That means you, neck brace. Do not ask me how much longer.
How much longer, Mamacita?
Less. Oh my God, man.
baby.
What the hell? Does Turk know you're here?
He has no idea. JD is here.
Felt it.
It's that spidey sense.
Coming in hot. Ready to receive. Whoa.
Like that.
No. It's your sciatica. Engage your core, Bear.
I think it might be time to retire Eagle.
She's right, JD. It's time. Call it.
Did we ever see Eagle? I don't think so.
No. They kept the original.
Just a little bit, like a little tweak to it.
Yeah.
I'm no Superman.
Oh, and then of course you have to have the iPad now because they don't do read rooms anymore.
Oh, they don't.
Should we go out to dinner?
Yes. Do you guys have a place you usually go?
Buddy, we haven't been out to dinner since the Disney princesses were white.
Wait, what? Oh, we might have to backtrack that.
He just said we haven't gone out to dinner since the Disney princess.
Why's that so funny to you?
I don't know.
I guess he's saying it's been a minute. Well, I feel bad now that I paused this. I wanted to clarify that there are still radiologists still sit in the rooms that they consider read rooms, but they're reading it on a computer screen rather than a film with a light box. So anyway, sorry to interrupt. All right.
He had 4 daughters, Izzy, Ellie, Sophia, and Nora.
Izzy, Beetle, take care of Ella.
Alabella.
Why don't I have a nickname?
Oh, you do, sweetness? You're the accident.
I'm just so happy they kept the humor.
I know.
That's where our love story began.
Do me right here.
Okay.
See?
Oh, by the way, our marriage didn't make it.
I have a patient. I'll be gone soon, I promise.
So they got married.
Yeah. Well, we knew that was going to happen. I mean,
Kind of figured.
yeah.
We agreed in couples counseling that in order to have a healthy post-divorce life, we need to respect each other's space.
I hate couples counseling.
Full of your tone to avoid negative patterns from our marriage.
I love couples counseling.
I don't want to backslide. I can't just light all those candles again. It was really cold, and I got a ticket for scaring the ducks.
She still looks good. I think they all look good.
Yeah, they do.
Okay, your labs look fine. I think you're just dehydrated. Who admitted you?
I did.
I ask why? No judgment.
None taken. I admitted her because I'm a good doctor.
Okay.
When doctors fight in front of a patient, they always try to make it sound friendly.
These labs are normal. If it helps, I could explain to you what all this is.
So nice to meet an incredibly stupid person.
All she needs is hydration and emollient laxatives.
There he is.
The
Dr.
chief
Cox.
of medicine, my mentor.
Chief of medicine.
Can I do for you there, oldie? Damn it. Harry, Dr. Park here needs to know that my medical expertise is on par with his.
At the top of his class at Stanford, whereas your current claim to fame is handing out erections like tiny hot dogs at a bar mitzvah.
Saramieo?
Etanami Jedia. Dr. Park is teaching Corinne. Actually, it is good to see you. I miss the days when you were an intern.
Oh, you don't have to
I
say
think not
that.
moving real well.
I know.
Had a load of this motley crew.
All the interns.
Oh, God.
We're doing TikToks.
I can't work in crazy hours or even abuse them anymore.
And that's about it.
Not the good old days anymore.
Case in point, TikTok.
Oh, hey, Dr. Cox.
TikTok.
Fabulous if you could come in early and observe.
I'm good. I just watched one on YouTube like 2 days ago. It slapped. Do you know Dr. Randy? He breaks down procedures while doing bedtime AS. I'll send it to you. You're gonna die.
I will die if you said that. I'd have to murder you, and with all these witnesses, I think it's pretty safe to assume they'll give me the chair.
Dr. Cox, I'm gonna need you to go ahead and bring it down.
Oh.
It's the new admin.
Yep.
Principal of our wellness program. Now,
Wellness program.
then you'll have to join me at my sensitivity training workshop.
Oh, God.
Don't I get 3 strikes?
You have 900 strikes.
Really in touch with male feelings.
How do you think I became a feelings cop?
What the hell?
I could help so many people.
Hey.
Good morning, sir. Dr. Chapstick is flirting with you?
Dr. Chapstick.
Last Thursday, he did tell me that he thought I had a cute burp. Turk, thoughts?
Yeah, he totally wants to get on that flat ass.
Chug half of that and go launch a cute burp into that man's face.
A cute burp?
Hey, guys.
I cannot believe I wasted that on you.
Hey, by the way, if you can get out of here early, we can hit the happy hour that has those awesome free wings.
Let's do it.
And if the results are what I think they are, I should be able to get you out of here today, all right?
Oh, thank goodness.
I wonder if he'll be wrong.
Please, I need to go count to 10. This one asked if he could shut his eyes while I place a central line.
Oh.
I'm Dr. Green. I believe kindness is the best medicine. Actually, medicine is the best medicine. You're gonna get
He's a little more snappy.
I know.
God, this is humiliating. Now, don't be overconfident. Finding the radial artery can be tricky.
Yeah, that's closer.
Nice job, Blake. You made that look handsome. Easy. Easy does it.
I gotta admit, I miss teaching.
Oh, is he going to go back then?
I think so.
No, just watch.
Okay.
Damn, I wish this guy would just die all at once instead of in tiny little pieces.
Who's Dr. Bummer?
I don't know, some other guy. Definitely not your best friend.
Turk's not a bummer.
He is the worst.
There's no way.
Oh no.
What's up? And he'll die laughing. I swear. Try it.
Was that?
Go practice.
And he refuses to talk about it.
Y'all talking about Dr. Turk? If so, prayers up.
Even Hooch knows?
Hooch. I don't know if we've met that
Nope,
guy.
we haven't. I'm sure we will.
I was right about my patient. Want to come watch me rub it in Dr. Cox's face like the good old days?
You know I do. Hey, but you know what? You should chew a big wad of gum. You always look tough when you chew gum.
I do look tough when I chew gum.
You just take a quick look at her.
Look, man, you can't order healthcare from your car, okay? It's a hospital, not a Wendy's.
Sorry.
You could be a little nicer there, buddy.
I know.
Look, just to jump in real quick here. So there is a medical legal issue
Yes.
here. You really can't go out and properly and appropriately evaluate a patient in a car park. I will say I have been called when I was a residency and we would hold the code pagers. I actually was called to a code in the parking garage. And the other resident and I, we had no idea where we were going. It was in the visitors parking garage, which we didn't park in. We parked in the staff garage. And so we're like, where's this code? Like running around. And finally we could hear like nurses. And so we found it. And thankfully it actually ended up being kind of a false alarm. It wasn't a true code. It was actually somebody who had left the ER, went to their car, taken some drugs and passed out.
Oh.
They were okay. They were fine. We got them back into the hospital. We're back into the ER and Narcaned them and everything was fine. But you can more politely say, unfortunately, like I would love to be able to help. There's a protocol for this. Fortunately, we have, if this person's, they have to be a patient. They have to be treated like a patient. I'm getting like Ogilvy vibes from the pit.
From
like
the
with
pit,
this guy.
yeah.
It's like this just happens to be a better looking Ogilvy who seems talented, but I mean, we're talking about zero tact or bedside manner. At least so far. We'll see. We'll see. I mean, look, I think these shows tend to get you to like these people eventually, but I don't like that interaction.
Yeah.
Mrs. Brooks, blood guy.
I can't understand a word you're saying.
I know because the stomach has too much bubba. I can't control it. Berry's blasting all over my mouth.
Give it to me. Go ahead.
Mrs. Brooks. Your boy botched it.
Well, my boy here needs to burn you in it because he's on fire.
You both owe me an apology.
I'd rather self-circumcise.
You two idiots are perfect for each other.
Let's get winged.
You look so tough right now.
Your interns call you Dr. Bummer.
You know, I really don't want to talk about it right now. I just want to go out and blow off some steam.
To the free clinic.
Yeah.
Oh, boy.
Come on, man. What is up?
I'm burnt out.
Yeah.
My patient today is a perfect example. Once he heals, he's going to ignore my advice and go right back to drinking and eating garbage. We can laugh the day off with a couple of beers, but can't do that anymore, can we?
Man.
Wow.
You're right, Scripps in the suburbs. I don't feel like going on anymore. I'm going to go home.
Oh.
What's up?
Not tonight, JD.
Ooh, you okay?
No.
Good.
Doing my best angry walk because after Turk told me he was going home last night, I heard he went out with someone else.
What the hell, man?
Is this the
Well,
Todd?
we did therapy. I didn't want to go deep.
The Todd really likes to go deep.
With consent.
High five.
Hey, Carla, if you were planning on having sex with Turk tonight, don't. He doesn't deserve it.
She's not. Their sex night's Thursdays. What? I didn't even mention that you do it in the minivan because of the kids. Someone decided to keep JD's patient here a little bit longer.
Why is JD being here so very hard on you? Aren't you the one who ended the marriage?
Did you hear that?
Who can say?
Carla?
Why do you have the physique of a menopausal lesbian?
Whoa, too mean.
Not now, oldie. Impression that you were able to place a central line since you learned from your Dr. Randy, was it?
But he was really chill and you're giving mean football coach vibes?
Miss Tosh, you'll notice I'm not saying Dr. Tosh.
Dr. Cox?
Bring it down.
You know, it used to be see one, do one, teach one. Alas, it is C1, 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 C1 more. Call your therapist. Talk about how it felt to C1.
Talk about what it felt like.
Hang on to the scrubs. Maybe use them for Halloween, because you're damn sure not going to be using them around here much longer.
I'll see you Saturday.
Worth it.
Worth it.
What?
Oh, it's this little song I hear in my head whenever I see you.
Oh, I love it. Feelings of me.
You got it. You can do this. Guide that finder needle into the jugular.
Oh my.
It's on my face.
Looks like we got an artery.
Why don't you go take a couple, okay? 5, 10, 15, whatever you need.
Do you think that was a callback to that episode we just saw where he was telling the girl that he put a... Did he say he was putting an IV in and it shot him in the face?
Oh, I don't remember that.
It was when they went to that bar and he was...
Oh.
Yes.
Oh.
We just released that episode, I think.
Oh, yeah. At the free clinic.
Yeah.
When he's like bloodshot everywhere.
Yeah.
Yeah. Maybe.
He said it on his face.
Well, so this, I mean, that looked like an arterial bleed. I mean, and so they always tell you, like, you know, if you hit the artery, apply lots of pressure.
Do they normally under plastic like that?
Yeah.
Oh, okay.
It's kind of a sterile field.
And they're awake?
They can be, although you're probably not. So usually when we're throwing a central line in, the patient is very ill, very sick.
Oh, okay.
And
He was over there like...
Right. Like they may be alert or aware, but like they're so sick that they're not really even responding like that. Because you need central lines when you need, say, high volume like pressors to keep blood pressure up because the patient's in septic shock or something and they're crashing. So you wouldn't typically see someone look that good who needs a central line.
It was funny though. So
I'm good with it. It was. But like when you're doing that, like, so for students, like you're using the ultrasound to try to identify the IJ, the internal jugular, and you push the probe down on it to make sure it compresses. And so that's sort of one trick to make sure to differentiate, say, the internal carotid from the internal jugular. It compresses, you're like, okay, that looks like the vein. And then if you hit the artery and blood goes, like, because it's pulsing, that's a problem. And then you can recover from that. You just have to apply pressure for a long time. But anyway, obviously it was funny.
I know, it was.
All right, let's play.
Okay, this job is really rough. So you're going to need people.
Well, I'm not a kid like them, so don't worry about me.
Not if nobody has your back. Yeah. Trust me.
He's going to get through eventually.
That's why I kept your patient here.
Yep, I knew it.
I'm sorry, what?
To keep you here.
Keep you here, JD.
Getting her through that procedure, that inspiring nonsense you just said to that gorgeous young man. I want you to come back.
Oh.
Are you messing with me?
No.
Dr. Dorian, can I talk to you? The reason I chose this hospital was because of you. Like the only other black surgeon in this place. Hey, the rest of them just got Coldplay on loop in the OR and say stuff like, wow, you're so articulate.
Oh my gosh.
Now we leave so he can feel horrible about himself.
Shauna, you stay. You're going to close. Are you good with that?
Yep, JD needs to be back with him. The yin,
Make a
yin
difference.
tis yang.
Oh, and Shauna, this brother likes Coldplay too.
Oh.
Sometimes when you feel a little lost, the world gives you a sign. It's just not always a good one.
She's found unresponsive in her car. Heart attack. We're trying, but she's gone.
We're trying, but she's gone.
Why couldn't you have helped us?
That was the person in the car.
You just said it was a stomachache.
You can't get through them on your own.
So they just have to remind you that they put crappy things in the show too and make you feel like crap.
Sad things.
Yeah.
It would have taken me 1 minute to just walk out there and check on her. Now she's dead because I didn't walk outside.
Oh, look, he's gonna find.
And like that, I knew what my decision was.
Hey.
You don't miss that?
You're not going to be working with me. You're going to be me. You're the new chief of medicine.
Oh, no.
I can't be you.
What?
You're right. Dr. Park really wanted this job. And his hatred for you is going to go quite on. And that thought
Maybe more reason to do it, JD.
will keep me warm at night.
I'm so glad he's still Dr. Cox.
I know.
But one thing's for sure. I can't do this all on my own.
Because you're no Superman.
Yep. Are they on the roof?
I think so.
Yep.
Some guys are actually calling their friends at night to say goodnight.
There's just something about hospitals and a roof.
I
Right?
guess, yeah.
Do you think it would be cool?
Not a shot in the dark.
I don't want to do it either.
Maybe once a week.
Wednesday it is.
All right. Great episode 1.
I'm happy
Really.
that we did that.
Yeah, no, this was really good.
It
Yeah.
was awesome.
Yeah, very good. So, you had to wonder, like, what was Scrubs going to look like in 2026, right? I mean, some of the humor from the original series.
Oh, I'm so happy about that.
Was it going to translate today? How are they going to bring in kind of some of the current themes of, say, youth and whatever? So very skillfully done.
Yeah.
Beautifully done. Hilariously done. And kind of like, a smidge emotional too. Like,
I know.
just like the, I know that we just started watching Scrubs maybe a little over a month ago, but like I kind of felt like JD was saying, like, I miss you so much sometimes it hurts, or what was the line? I miss you so bad sometimes it hurts. That was what he said that to Turk, but then Turk said it basically said the same
Oh,
thing.
okay, yeah.
I kind of felt like that, when he came back into the hospital. I wrote down a couple of things, but man, what a great episode. So much stuff there. But I hope that Dr. Cox isn't like leaving. I think the implication there is he's leaving, stepping away, letting JD take over for him. Because, he's kind of right. Like, his style is the days of old. So, So I can't like torture them anymore. I can't punish them. I can't keep them here for, they learn things on TikTok. And so anyway, I wrote down a couple of things. I mentioned Concierge Doc. Again, for those of you who maybe don't know what that means, it's kind of specifically in the outpatient world, and it is exactly that. It's basically like having a membership with your doctor where you pay a retainer fee, an annual fee, and then of course I believe that doctor still also bills your insurance for care provided. But it's
I don't know.
There's something with it. I don't know all the ins and outs because I'm not a concierge doctor. A lot of doctors have gone into this for the, say, benefit of, quote, quality of life. They can see far fewer patients. So their panel size, is how many patients that are attributed to us as their doctor, is much, much smaller. But the access, I think, is higher. Like, in theory, like, I don't know that they all make house calls. I'm not sure how that works here. But like, kind of what Dr. Cox was getting into, and even I think Turk said, like, you're like, come here and make a difference. Like,
yeah.
Not that what you're doing out there isn't important. Someone like JD, who is so passionate about patient care, his position, his role is in the hospital, I think, personally. And then I kind of piggyback off of that. I can tell you there's almost nothing greater than going back into the hospital, though, when it's been like years since you've been there.
Yeah.
And seeing all of the people that you worked with, and that, the nurses and the some of your fellow colleagues that ended up staying in the hospital, coordinators, program coordinators, directors, things like that. Like, it's so cool. That makes me want to go back and visit my old residency.
Maybe you should.
I've actually been thinking about it for a long time, so I want to go back and just see
You
it.
think about pulling a JD and
Going back to the hospital. Look, I did love, there's part of me that would love to do that would love to do what JD's doing, to work with the residents, to educate. But I don't know that, I like my outpatient world as well. I do have students and things that come
they do.
see me, so I do get to teach. I do enjoy being part of that. And then again, like, one of the big themes here, it was nice to see Todd. High five. Todd likes to go deep. Well, you didn't know exactly what kind of humor he would have, because again, like,
I didn't know what they were going to be allowed to say.
It's a different time, and but hey, I was glad to see it.
Yeah.
And then, of course, I think a big issue in medicine is this idea of burnout. Turk's burnt out, right? And sometimes, I don't know if burnt out is the right word or term. Sometimes maybe referred to as like a moral
jaded.
Moral injury.
Oh yeah,
right?
that's right.
There's a lot of reasons that one might become sort of, quote, burnt out. He was kind of saying that, that this patient's going to go out. They're not going to listen to a thing I say. They're going to end up back in here, and then I'm going to be blamed. And that's maybe one angle. Then there's also the sort of the bureaucratic angle of, insurance and not being able to provide what you think is the highest level of care because there's so many third-party intermediaries and, frankly, non-clinical personnel that are making all these decisions about patient care. I can tell you that's probably the thing that leads to the highest degree of dissatisfaction for me in my practice, is sometimes feeling like we are fighting this sort of nameless, faceless entity that we don't have the tools to fight, and therefore we keep getting kind of plunged into this just abyss of, I can't be the doctor I need to be. So that is tough. And I think you find doctors all across this country who share that sentiment. I think it's great. I think they brought up some of the current issues in medicine, and we'll see more of that. I mean, again, how about too the fact that that lady that died, obviously very sad. It's not really that doctor's fault. He could have handled it a lot differently.
Yeah.
But they didn't come in because they didn't have insurance. I think is what it said, right? Isn't that what he said? Don't have insurance?
Well, he said it would be too expensive.
Too expensive.
Yeah.
Right. So again, this is highlighting another problem, people delaying seeking care because they can't afford it. They might have insurance, but can't afford to use the insurance.
Yeah.
And so, I mean, look, gosh, a great episode. Really cool. It kind of makes me excited though to jump into more original Scrubs though too, so we can kind of keep going with that story, kind of seeing, and maybe because I know they released episode 2 already as well. We're gonna watch that next, but maybe we can keep churning along before too many more of these episodes come out.
Yeah, I know.
All right, guys, this was so much fun. Thanks for coming and checking this out with us. We hope you come back for the next one and the next one and all that, and go check out the original Scrubs reactions because we're still churning those out too. Till next time, good night.
See ya.
I am Dr. Todd.